Good afternoon, everybody. My name's Jessica Lowery, and I'm going to be talking about a critical evaluation of a quality improvement tool, and I've chosen the PDSA cycles. The PDSA method is a well-known quality improvement method that was based on techniques used in industry. It was developed through the work of Walter Schuhart and Edward Deming, who introduced the concept of continuous improvement cycles, and this later evolved into the 4 stages of PDSA. Users of the PDSA method followed a prescribed 4-stage cyclical learning approach to adapt changes aimed at improvement. In the plan stage, a change aimed at improvement is identified. In the do stage, it sees the change tested. The study stage examines the success of the change, and the act stage identifies adaptations and next steps to inform a new cycle. By using quality improvement tools such as the PDSA, healthcare teams can improve quality and effectiveness through ongoing process improvement. They can limit risk by testing changes on a small scale before full implementation. Support learning through hands-on real-world testing, guide decision-making using data and measurable results, gain a better understanding of underlying problems that are causing the issue, and gain insight as to how best to go about the improvement and develop an effective strategy to complete a project. For the purposes of explaining each stage of the PDSA cycle, I will look at a healthcare problem and review the problem in each phase of the cycle. Planning is the first and foremost step in the PDSA, and sufficient time and resources must be allocated to this stage. Thorough and careful design helps to prevent wasted PDSA cycles and also determines the final quality and success of the QI project. An example of this in healthcare may be to aim to increase the number of influenza vaccinations given to a specific patient cohort, such as those aged over 65 who have diabetes, asthma, COPD. So we need to assemble an engaged multidisciplinary team. So who needs to be part of this change? Identifying and recruiting team members with the subject matter knowledge of the problem or opportunity for improvement is a critical first step. Making sustainable improvements requires a collaborative team effort. A multidisciplinary team brings in different expertise and perspectives that are critical to effective change. This helps to break down workflow silos and facilitates outside-the-box thinking for improvement ideas. Frontline employees should be included because they're the closest to the work and understand the vital details regarding the specific challenges at hand. Engaging frontline staff also can benefit for later stages of the PDSA cycle when change management is required. The pilot implementation do phase will be more successful if frontline staff are engaged in early planning. We need to define the problem and the goals. What are we trying to accomplish? The next step of the PDSA cycle needs the team to stay focused on problems without overextending their scope and setting specific, achievable and time-bound targets. Goals should be SMART: specific, measurable, attainable, relevant and time-bound. We should create an execution plan. We should assign tasks to each individual member, set timelines, allocate resources and track the status of the execution. The action plan should answer the following questions. Who is responsible for the task? What needs to be done? When is the task due? Where will the pilot take place? And what data needs to be collected? Following on with the same healthcare example in the doing phase, this might be to identify the at-risk patients and administer vaccines. The major tasks in this stage are measuring baseline data, piloting the improvement ideas, and observing the collect and follow-up data. It is critical to collect baseline data prior to implementing any changes. Baseline data not only confirms the need for the quality improvement initiative, but also allows and evaluates the effectiveness of your interventions through the comparison of before and after results. In addition to gathering quantitative data, you should also consider collecting qualitative feedback by observing processes and interviewing participants. As you watch what happens during the experiment period, you'll be able to document how the people involved react to the changes, problems raised, or unexpected effects. Qualitative feedback can help you adjust existing plans and can lead to new improvement ideas. An example of the study phase may be to compare the number of vaccinated patients to the total number of at-risk patients to measure the vaccination rate. We should evaluate the results. The effectiveness of the interventions can be determined by comparing test results with the goals that were identified in the plan phase. We might find that the change has been very successful, but it also is common to find that the results weren't as expected. The purpose is not to judge the PDSA cycle by deciding if there has been a pass or a fail. Even if we didn't achieve the original goals, the changes we have made still might achieve some improvements when compared with the baseline results. The process of evaluating the results is more about identifying the trends or patterns and learning from what worked and what did not. An example in the ACT phase, with the same goal in mind of increasing the number of influenza vaccinations given to a specific patient cohort, such as those aged over 65 who might have diabetes, asthma, COPD, etc., might be considering what went wrong and trying something new. Do we need to roll out an education and health promotion program for those at risk? Based on the results, we can choose 3 ways moving forward in the acting phase. We can adopt and scale up. When goals are achieved as we planned, we can scale up the test and roll it out across the whole ward, department, hospital, or district. At this stage, it's also important to consider plans to sustain the effort we have made or make even further improvements. We can change and retest. If the original plan didn't achieve the desired results, we analyse the discrepancies and try and understand why. It's in this stage that qualitative data, including discussion with the participants, can be useful. If what went wrong can be corrected, we consider changing the plan and retesting through a new PDSA cycle. We drop and we test a new change. It's very common to have a cycle that doesn't bring about the change we'd hoped in the quality improvement journey. If your team believes a different approach would be more successful, consider abandoning the current intervention and starting a new cycle with a different plan. The positives include reduced risk, testing changes on a small scale in the do phase minimises the risk of something going catastrophically wrong and putting patient safety at risk. It promotes a learning culture. The ongoing review style nature of PDSA cycles encourages continuous learning and adaptation within an organisation. Frontline engagement. The method empowers frontline staff to identify and solve problems, increasing their motivation and involvement. It's adaptable and versatile. Its simple yet sophisticated nature makes it applicable to a wide range of situations and stages of an improvement project. And it has a standardised approach. The structure of the cycle provides a consistent method for testing and comparing change ideas. The negatives might be resource demands. Successful implementation requires adequate resources, including time, funding, and staff expertise, which are often underestimated. It has a risk of misapplication. The method's simplicity can lead to oversimplification, where users do not adhere to its principles. It's not a standalone solution. PDSA cycles alone cannot guarantee desired outcomes and are most effective when used with other quality improvement methods. It has a limited scope of small tests. The small-scale do phase may not capture the full complexity of the problem, leading to findings that don't translate to larger implementations. It requires leadership and expertise. Sustained success requires strong leadership, familiarity within the method, and the potential for the supportive infrastructure. Potential for change fatigue. If projects are poorly managed, lack resources, or produce no real improvement, they can lead to disillusionment and change fatigue. Teams can often get stuck in the do phase, failing to progress to the study phase. And while these problems may reflect poor planning, they may also be caused by problems beyond the control of the project team, such as the challenges of creating time to conduct the tests of change, staff turnover, and changing or competing priorities. The PDSA cycle is a simple QI tool that requires few resources, can be deployed rapidly, and can lead to meaningful change. Thorough planning is critical to success. To be successful, you need to be able to measure either the outcomes you want, like quality and safety, or the steps you're taking to get there, or both. Qualitative data are important to collect because they can be invaluable in generating new hypotheses for process improvement. Data analysis is best performed using run charts or other validated visual QI tools. If your PDSA intervention is effective, policies should be formalised to reflect the QI changes and new workflows. To ensure success in quality improvement endeavours, quality leadership should plan to present the data collected and PDSA project ideas to as many people involved as possible. Quality improvement is innovative, iterative, and collaborative, and we should expect successes and failures as the process evolves. A successful PDSA cycle can improve patient outcomes, improve efficiency and morale and engagement amongst the team. Thank you.